Hello guys, welcome back to Medical Days. So today we'll be discussing about the physiology PYQs of Neetpg. But before moving on to the details of this video, I would like to introduce you all that our Neetpg 7-year SKU bank of all the subjects is completely ready and is out for sale at a very nominal price. It's available in the PDF format. So if you guys are interested, you can check the description or you can contact me in Telegram. So now moving on to the details of this video, which ion is most responsible for the RMP? Answer is potassium. So RMP is primarily determined by potassium due to its high permeability through leak channels at rest. Potassium efflux creates a negative intracellular charge of minus 70 millivolt. And the other options like calcium plays a role in action potentials and muscle contraction but has minimal contribution to RMP. Sodium is more important for depolarization, and chloride helps stabilize the membrane, but it is secondary to potassium. Which receptor helps in improvement of insulin resistance in DM2 with regular exercise and physical activities? Answer is GLUT4, because it is the insulin sensitive glucose transporter in muscles and adipose tissue. Exercise stimulates the GLUT4 translocation to cell membranes, improving the glucose uptake independent of insulin, thus reducing the insulin resistance. Other glutes are also important. Please go through them. Also the SGLT2 and SGLT1, again important. Please read about them. Next, a woman with sunburn feels pain when lukewarm water of 40 degrees Celsius touches her back. What receptors were activated and why did she experience pain? Answer is inoculous, thermal receptors and allodynia. So allodynia is pain from a normally non-painful stimulus, that is like the lukewarm water, due to sensitization of nociceptive pathways post-sunburn. So innocuous thermal receptors, that is not nociceptors, they are activated, but central or peripheral sensitization causes misinterpretation as pain. Next sequence of the events in neuromuscular action potential conduction is, answer is calcium enters at the nerve terminal, then the release of acetylcholine, and then the sodium channels open in the end plate. So this is the correct order. Next, what is observed on a PET scan in a patient with phantom limb pain? Answer is expansion of the somatosensory fibers for the hand into the neighboring areas. So phantom limb pain involves cortical reorganization where adjacent areas like the hand invade the deafferented limb region. So PET scan shows somatosensory cortex plasticity. Which tongue papillae does not have taste buds? Answer is filiform papillae. You need to also look upon the images of the different papillae. That is also very, very important. So filiform papillae, they are mechanical for grip and they lack taste buds. And taste bud containing papillae are the fungiform, circumvallate and foliate. So also learn the locations of the different papillae. Now moving on to 2023 PYQs. Identify the mark region in the given spirometry. So answer is functional residual capacity. Again, the spirometry image is something very, very important. Please learn about it. And also the restrictive lung diseases and obstructive lung diseases, that they are also very, very important. Please read about them. Next, a man was brought to the emergency after he had suddenly become unconscious while working in the field. On examination, his temperature was 105 degree Fahrenheit and his skin color was decreased. Which of the following would not be seen in the patient? Answer is sweating, because here the patient is having heat stroke. When the core body temperature is more than 40.5 degrees Celsius, it points towards heat stroke. And the thermoregulatory mechanism fails here, leading to anhydrosis, that is absence of sweating. Next. Identify the correctly matched pair of substances with their renal clearance from the graph given. So there should be a graph here, and please look upon it. So glucose is fully reabsorbed in the proximal tubule, so there is 0% remaining in the urine, and bicarb is partially reabsorbed, there will be some remains, and inulin is completely filtered but neither reabsorbed nor secreted, so there is 100% remaining, and PAH is fully secreted, so it is cleared more than 100%. So there should be a graph as well for better understanding, but this is how it is about the reabsorption. Next, identify the true statement regarding the given nerve action potential curve. Answer is point B to D is the refractory period in the given image. So absolute refractory period is from B to C. Sodium channels are inactivated here and there is no new action potential possible here. And the relative refractory period is from the C to D, that is the potassium channels open here and higher stimulus is required. Next question, identify the type of transport across the cell membrane given below. Answer is facilitated diffusion, because it shows the image shows a carrier protein moving molecules downhill, so no energy input is required here, and that points towards the facilitated diffusion. Next, a preterm baby delivered at 28 weeks developed respiratory distress syndrome. What is true about the surface tension and compliance? So surface tension is increased here and the compliance is decreased here. Surfactant deficiency in respiratory distress syndrome increases the alveolar surface tension and reduces the lung compliance, making stiff lungs. Next, a patient with severe muscle injury has serum potassium of 5.5. What happens to the RMP? Answer is it becomes more positive because hyperkalemia reduces the potassium gradient, depolarizing the membrane, making it more positive. Next, a cervical spine injury pierces the lateral dorsal column tract. What finding is seen? Answer is absence of ipsilateral arm proprioception. So fasciculus cuneatus, which is the lateral dorsal column, carries ipsilateral upper limb proprioception, and lower limb proprioception is mediated by the fasciculus gracilis, which lies medially. Next question. Identify the true statement about the marked point on the myocardial action potential curve. Answer is due to slow but prolonged action or prolonged opening of potassium channels. So all these curves and all are very, very important. Please learn about them. Action potential curve, this is very important. So here the plateau phase, the phase 2 is maintained by calcium influx, the L-type channels, and reduced potassium efflux. Phase 0 involves the sodium channels, which is marked as A, and phase 3 involves the potassium channels. 2022 PYQ. A person was sleeping overnight with arm under his head, now experiences paralysis but no numbness in the morning. Which of the following is the best explanation for it? Answer: A fibers are more susceptible to pressure changes than the C fibers. The patient has paralysis, that is partial paralysis, but no numbness, indicating motor impairment without loss of pain sensation. A fibers, which are large myelinated fibers, they carry motor, touch and pressure signals and are more susceptible to pressure-induced conduction block, that is neuropraxia. And C fibers, which are small myelinated fibers, they carry pain and are resistant to pressure changes, explaining the intact pain sensation. C fibers, they are less sensitive to pressure. Which of the following mechanism is seen in baroreceptor reflex? Answer is negative feedback. The baroreceptor reflex maintains BP homeostasis by counteracting deviations from the set point. So when there's high BP, baroreceptors via the glossopharyngeal or the vagus nerves, they signal the brainstem to reduce the heart rate and vasodilate. When there's low BP, reflex increases heart rate and vasoconstricts. A negative feedback prevents the overactivity, like example hypertension. Next, the image below depicts which of the following types of cell-to-cell signaling. Answering is paracrine. So paracrine signaling involves local diffusion of molecules to nearby target cells. Example, the endothelin 1 from the endothelial cells causing vasoconstriction. Synaptic signaling is a specialized paracrine mechanism. And the others are autocrine targets the same cell. Endocrine involves hormones via transport via bloodstream. Which of the following statement is true regarding the given cystometrogram? Again, cystometrogram images are coming up recently, important. So segment 1B is due to the Laplace law. 1A is the initial pressure rise from the bladder wall tension. 1B is the flat segment because of the Laplace law. Increased volume with minimal pressure change as the bladder relaxes. And 2 is the sharp rise from exudation reflex activation and not the failure. Next, in a patient, the hypothalamic thermostat was reset from point A to C as shown below. Which of the following happens in stage A compared to stage B? Answer is shivering. So hypothalamic set point reset to a higher temperature, that is like fever. In stage A, there is heat gaining, shivering, vasoconstriction and increased thermogenesis to match the new set point. In stage B, there will be heat dissipating, that is sweating, vasodilation after reaching the set point. Next question. A 65-year-old man suffered from a stroke 2 days ago. He now presents with involuntary, violent and flinging movements of the limbs on one side. Which of the following is the likely site of lesion in this patient? Answer subthalamic nuclei, because clinical picture showing hemivalismus, that is unilateral flinging movements. It is caused by lesion in subthalamic nuclei, which regulates the basal ganglia output. 2021 PYQs. A 30-year-old man weighing 70 kg had a sodium level of 120. Calculate the sodium deficit. So sodium deficit has a particular formula that is equal to 0.6 into body weight into target sodium minus current sodium. So if at all you apply this in this formula, the values, then you will get 840 milliequivalents. Next question. Beta-2 receptor action leading to hyperglycemia or hypoglycemia is mediated by which of the following enzymes? Answer adenyl cyclase. Beta-2 receptors activate adenyl cyclase, increasing the cyclic AMP, which mediates the metabolic effects. Example, glycogenolysis to hyperglycemia. Guanylyl cyclase is linked to CGMP. Example, nitrous oxide signaling. And phospholipase C and A2 are involved in other pathways. Next question, a body fluid sample has sodium of 10, potassium of 140, chloride of 4. Identify the compartment. Answer is intracellular fluid, because intracellular fluid characteristics are high potassium, low sodium and chloride. Next, a patient with multiple sclerosis likely has damage to which cells? Answer is oligodendrocytes, because multiple sclerosis involves autoimmune destruction of the oligodendrocytes, leading to demyelination in the CNS. Next, ORS facilitates glucose absorption via which receptor? Answer is SGLT1. So ORS uses SGLT1 for coupled sodium glucose absorption in the small intestine or renal tubules. SGLT2 is renal specific, that is through the early proximal tubule, and GLUT4 is insulin dependent through the muscle or adipose tissue, and sodium calcium transporter is unrelated to glucose uptake. 2020 PYQs. PYQ is equal to infinity holds true in which of the following conditions? Answer is equal to dead space. So PYQ is equal to infinity means there is no exchange of oxygen and carbon dioxide, which occurs when the lung volume equals the dead space, rendering the physiological effort of breathing as wasted. Next question, prolactin level is highest during 24 hours after delivery. Prolactin levels peak during pregnancy and immediate postpartum period, reaching their highest at the delivery, and suckling further stimulates the prolactin release. Next question, C wave of JVP. JVP again a very important area, and C wave of JVP is tricuspid bulge into right atrium during isovolumetric ventricular contraction. The C wave is caused by the tricuspid valve bulging into right atrium during the isovolumetric ventricular contraction. Next, the protein in the glomerular basement membrane responsible for charge-dependent filtration is, answer, heparan sulfate. So heparan sulfate's negative charge repels the negatively charged proteins, playing a key role in charge-dependent filtration in the glomerulus. Which of the following clotting factors would have decreased gamma carboxyglutamate residue in a patient on warfarin therapy? Again, vitamin K and its pathway is very important. And the factors dependent on vitamin K. So here, factor 2, warfarin inhibits vitamin K dependent gamma carboxylation of clotting factors 2, 7, 9 and 10, reducing their activity. Next, which of the following conditions would have the highest levels of ACTH and cortisol? Answer is Cushing syndrome. It is caused by ACTH secreting pituitary adenoma, leading to excessive ACTH and cortisol production. Next, which following complete ileal and partial jejunal resection, the patient is most likely to have vitamin B12 deficiency, because vitamin B12 is absorbed in the ileum. Next question, respiratory distress syndrome is due to defective type 2 pneumocytes, and type 2 pneumocytes, because they produce the surfactant, and their dysfunction or surfactant deficiency causes respiratory distress syndrome. Which of the following hormone uses receptor tyrosine kinase signaling? Answer is insulin. Insulin and growth factors like VEGF and PDGF use receptor tyrosine kinase signaling pathways. So all these signaling pathways are also again very important. Please learn about them. The cyclic AMP, cyclic GMP, all these dependent pathways are also very important. Please learn. What is the site of lesion in Wernicke's hemianopic pupil? Answer is optic tract. So Wernicke's hemianopic pupil occurs due to the lesions in the optic tract affecting the light reflex in the blind half of the retina. Next, a 65-year-old man suffered from stroke 2 days ago. He now presents with involuntary violent and flinging movements of the limbs on one side. What is the likely site of lesion in this patient? Again, this is a PYQ. Same repeat question had come up previously. So answer here is subthalamic nucleus. Hemibalismus is caused by a lesion in the subthalamic nucleus, part of the indirect basal ganglia pathway, and unilateral flinging movements of the proximal joints is a feature here. Now 2019 PYQs. According to myogenic hypothesis of renal autoregulation, the afferent arterioles contract in response to stretch induced by, answer, opening of calcium channels. So myogenic autoregulation involves stretch induced contraction of afferent arterioles. Stretching opens the voltage dependent calcium channels, causing calcium influx and vasoconstriction. According to Harrington's classification, decerebrate rigidity is characterized by all except, answer, rigidity occurs in all muscles of the body. So decerebrate rigidity involves extensor muscles of all 4 limbs, not all muscles. The gamma loop is activated, increasing the gamma efferent discharge, and spinal shock is absent because brainstem pathway remains intact. Which of the following is true for decorticate rigidity? Answer is it is characterized by flexion of the upper limbs and extension of the lower limbs. So decorticate rigidity involves upper limb flexion, rubrospinal tract, and lower limb extension because of the unopposed reticulospinal drive. Acid citrate dextrose used to store blood preserves RBCs for 21 days. The storage period when adding phosphate alone and when adding adenine and phosphate together to ACD would respectively be 21 days and 35 days. So adding phosphate alone does not extend the storage beyond the standard 21 days for ACD, whereas adenine plus phosphate extends the shelf life to 35 days by supporting the ATP synthesis in the RBCs. Next, functional residual capacity is expiratory reserve volume plus residual volume. So that's spirometry graph, and the calculations from there and the values are also very, very important. So here FRC is equal to ERV plus RV. It represents the air remaining in the lungs after normal expiration. Next question, which of the following is not a dietary fiber? Answer is gums. So all options other than provided here are dietary fibers, but gums are minimally consumed in typical diets. Next, lesion in the medial lemniscus at the level of pons causes which of the following? Answer, loss of tactile and proprioception on the opposite side. The medial lemniscus carries contralateral fine touch and proprioception signals. After decussation in the medulla, a pons lesion affects the opposite side. Pain or temperature involves the spinothalamic tract, not the medial lemniscus. Next, which neurotransmitter is responsible for anterograde dilation of the small intestine? Answer is VIP. So VIP and nitrous oxide mediate the anterograde relaxation ahead of the bolus during the peristalsis, and the retrograde contraction behind the bolus is mediated by the substance P and acetylcholine. This again is a very, very important topic. VIP and nitrous oxide, they maintain the anterograde relaxation, whereas the retrograde contraction is by the substance P and acetylcholine. Please try to remember this, an important point. Next, reflex responsible for tachycardia during right atrial distension is Bainbridge reflex. All these reflexes again are very important. J reflex, Cushing's, Bizzell, Jarisch, Bainbridge, all these, please read more about them. They're very, very important. Next, testosterone production is mainly contributed by answer Leydig cells. So Leydig cells in testis, they synthesize testosterone. Sertoli cells support spermatogenesis, but they do not produce testosterone. Next, what is the function of tubuloglomerular feedback? Answer is regulate GFR. So adjust the GFR based on the sodium chloride concentration and the macula densa. High flow reduces the GFR and vice versa. Based on the agglutination test shown, what is the blood group? So here it is O positive because there is no agglutination with anti-A and B in that image which was supposed to be shown. So please check upon the images of O positive, and if there is no agglutination in A and B, then it is O, and when there is agglutination in the next one, there will be it will be positive. So agglutination with anti-RH here confirms the positive. Next, which neurons predominantly fire during forceful expiration? Answer is ventral group of neurons. So they activate during forceful expiration, example exercise, and dorsal group controls quiet breathing. Pneumotaxic center limits the inspiration. So this again, all this dorsal group, ventral group of neurons, their actions, pneumotaxic center action, all these are again very important. Please learn about that pathway more. Next, ADH acts through which aquaporin channel? Answer is aquaporin 2. Aquaporin 2 channels in the collecting duct are regulated by ADH. Aquaporin 1 is constitutive in proximal tubules, and aquaporin 3 or 4 are basolateral channels. Which of the following has the least conduction velocity? Answer, postganglionic sympathetic fibers. So type C fibers, which are the postganglionic sympathetic fibers, they have the slowest velocity of 0.7 to 2.3 meter per second. Somatic fibers are the type A alpha fibers, 70 to 120 meter per second. Preganglionic are type B fibers, which have speed of 3 to 15 meter per second. Which part of the liver stores vitamin A? Answer is Ito cells, which are the stellate cells. They store vitamin A as retinal esters. Kupffer cells, they are macrophages. Hepatocytes, they synthesize proteins, but they do not store vitamin A. Next, liver synthesizes all of the following except answer immunoglobulins, because immunoglobulins are produced by plasma cells, not the liver. Liver synthesizes albumin, clotting factors, and acute phase proteins. Next, which ion is involved in peripheral oxygen sensing chemoreceptors? Answer is potassium. So oxygen sensitive potassium channels in carotid or aortic body glomus cells close during hypoxia, causing depolarization and calcium influx. So calcium mediates neurotransmitter release but is not the primary sensor. Brown-Sequard syndrome is characterized by answer pain and temperature lows on the opposite side. Spinothalamic tract damage causes a contralateral pain and temperature lows, which is after the crossing the spinal cord, and ipsilateral motor lows and fine touch deficits due to the posterior column also occur here. Now 2018 PYQs, the predominant organ producing insulin-like growth factor 1 is answer liver. Growth hormone acts on the liver to produce somatomedin, specifically IGF-1. Next, what is prosopagnosia? That is difficulty in identifying known faces. It is a visual agnosia characterized by inability to recognize familiar faces. Other options also symptopagnosia, that is body part recognition, simultagnosia, that is multi-element recognition, and tactile agnosia, object recognition by touch. There are other conditions. Here prosopagnosia is difficulty in identifying known faces. Next, all of the following are components responsible for countercurrent mechanism in the kidney except flow of tubular fluid from PCT to DCT. Countercurrent mechanism relies on water outflow in the thin descending limb, active sodium transport in the thick ascending limb, and passive sodium outflow in the thin ascending limb. Flow from PCT to DCT is unrelated to the loop of Henry's countercurrent function. Next, glucose is absorbed in intestine by answer secondary active transport. So glucose absorption occurs via the sodium glucose co-transporter SGLT1, which is a secondary active transport mechanism. And which of the following condition is oxygen therapy not useful? Answer central respiratory depression. So high dose oxygen in central respiratory depression suppresses the hypoxic drive, peripheral chemoreceptors, worsening the ventilation. V by Q is equal to infinity means there is no exchange of oxygen and carbon dioxide. V by Q is equal to infinity implies ventilation without perfusion. No gas exchange occurs here. Alveolar air equilibrates with the inspired air. C wave in JVP is seen in answer isovolumetric contraction. Both these questions are again previous year questions. They are repeat questions. C wave occurs because of the tricuspid valve bulging into the right atrium during isovolumetric ventricular contraction. All of the following are true regarding the actions of endothelin 1 except answer bronchodilation. Endothelin 1 causes bronchoconstriction via the ETB receptors. Aldosterone secretion is maximally stimulated by answer hyperkalemia. So hyperkalemia and renin-angiotensin system are primary aldosterone stimulators. Next, cyclic GMP is the second messenger of answer nitric oxide. All the cyclic GMP, cyclic AMP mediator, all these are again very important. Please learn about them. Next, transport molecule for Fe2 into the enterocytes is answer DMT1. DMT1 mediates the Fe2 uptake into the enterocytes. Nuclear, again this ion transport is again very important. Please learn more about it. Next, nuclear signaling pathways are all except answer rat proteins. They are not nuclear signaling pathways. They refer to recombinant rat proteins, caveolins and NF-kappa B, and importance, they are involved in signaling. Which of the following statement is false about Cuthbertson's metabolic ebb and flow responses to trauma? The ebb phase leads to activation of the innate immune system and induction of the hepatic acute phase response. The flow phase activates the innate immune system and hepatic acute phase response. Ebb phase is characterized by reduced metabolic activity to conserve energy. Next, kidney responses to shock by answer increasing the afferent arteriolar resistance. In shock, afferent arteriolar constriction reduces the renal blood flow and the GFR. Efferent arterioles constrict more, but GFR decreases overall. So that's it, guys. Physiology, all the 7 years PYQs have been discussed in this video. And if you guys are interested in buying the PDF, just contact me in Telegram or please check up the description. You'll get all the 7 years Neetpg PYQs in a very compiled manner. So that's it, guys. Till I come back with my new video, stay tuned. Till then, bye-bye.